quite emotional to see numbers increasing, particularly after years of decline.
Fewer people are being diagnosed with and dying of HIV and AIDS around the world. But in Canada, while deaths are down, infections are on the rise. In 2023, there were more than 2,400 new diagnoses of HIV, a 35% increase compared to the year before.
We should be alarmed. We should be both ashamed and urging our federal government and our provincial governments to do what British Columbia has done so that we can free our country of the curse that HIV has been.
In BC, both HIV treatment and prevention medication is free, which Montana says is the reason for the province's success against the disease. But he says other provinces are falling behind.
In the rest of Canada, the eligibility for coverage is very uneven. And as we have shown before, it's critical that these medicines and everything else related to HIV care be made available free and without barriers.
It's also discouraging to see that in a country as wealthy as Canada, with the kind of healthcare system we have, the kind of tools we have, yet people are still falling through the cracks.
Jollamore's organization is among 20 others across Canada, calling for more funding from the federal government, including $50 million each year to improve access to HIV treatment and care. He says Canada's HIV response is underfunded and has not seen an increase in more than a decade.
Complacency is not going to end HIV. Really, we need to continue to be vigilant, we need to pay attention to these increases, and we need to invest accordingly to ensure that people get the tools they need.
Vancouver's Dr. Peter Centre is a healthcare facility in the West End that began as a place where people with AIDS could receive compassionate care. The CEO says while AIDS treatment has improved, especially in Vancouver, the fight against the disease is far from over.
Normally now what we see in Vancouver, if someone is developing illness from HIV, it's usually because of a lot of other factors as well. They may have mental illness, they may have homelessness, they may have a substance use issue.
These experts worry Canada will not meet targets set by the United Nations to end HIV as a public health threat by 2030. Maurice Katz, CBC News, Vancouver.